Hello guys, this is Dr. Palnappan Manikam. In this video, we are going to see whether you can take COVID-19 vaccine if you are on blood thinners or not. Let's dive deep into it. So the most common question I've been asked is, can I take the COVID-19 vaccine if I'm on a blood thinner? The short answer is yes. You can take the vaccine if you had any clotting problems in the past, whether you are on a blood thinner now, or even if you have read the word blood thinner somewhere. So if the answer is yes, why are they making a big deal about blood thinners and COVID-19 vaccination? It is because the mode of administration of the vaccine. So the vaccine is getting injected using a small needle inside your thigh. So if they hit a blood vessel or something during the administration, it might cause some bruising or some hematoma, like a blood clot around this area. And this might be a little bit more worse if you are on a blood thinner. And that is the main concern. So the irony is, COVID-19 infection can cause blood clots inside your body. So if you are on a blood thinner, which means that you are at increased risk of blood clots some way or the other. So you are the patient who really needs to get the COVID-19 vaccination. If you are on a blood thinner, it is almost similar to having a road traffic accident already while driving, and you are asking now whether we should wear a helmet or not. By the way, I have seen so many people wearing the helmet by the side of them and not on the head. It is almost similar to wearing a mask on one side of the ear, and when somebody comes in, the patient goes like this. So the main problem is, during the trial, there were not a lot of patients who were on blood thinners. So the FDA cannot officially declare that patients on blood thinners can take the vaccine. So FDA said, if you're on a blood thinner, talk to your doctor. But FDA did not talk to the doctor regarding what to tell the patient if they are on a blood thinner. It is almost similar to when you call a friend, the voicemail says, please leave a message. I'll get back to you as soon as possible. And then it comes out as the mailbox is full. So the bottom line is, there is no significant contraindication for vaccination if you are on a blood thinner. There are three things that you should do. Number one, when you are getting vaccinated, ask about the size of the needle. So you want the smallest needle so that you don't get that much amount of bleeding when they inject into your muscle. So there are two kinds of needles usually. One is 23 gauge needle and the other one is 25 gauge needle. So this is the size of the needle. So the higher the number, smaller the size. So the 25 gauge is smaller than the 23 gauge. It's almost similar to obesity and immunity. The higher the waist circumference, the lower the immunity. So if you're on a blood thinner, when you get vaccinated, it is absolutely okay to ask the vaccine administrator what kind of needle it is and choose the smallest needle. Point number two is, after the injection, apply firm pressure for at least 2 minutes. Do not rub a lot. I've seen people who are over enthusiastic, they rub so much to a point that there will be no arm. And point number three is, it is reasonable to consider skipping 1 or 2 doses of blood thinners prior to vaccination. So it depends upon what kind of blood thinner are you in and what kind of disease that you had to start with. So please talk to your doctor regarding that. Every blood thinner has a different half-life. So the timing of stopping the medication depends upon what kind of medication you are in. Usually it is okay to skip 1 or 2 doses, but it depends upon which medication that you are in. One of my friend was like, Dr. Pal, what happens if I'm on a blood thicker? Blood thicker? I have never heard about blood thicker. He says, no, it is written on the website. If you're on a blood thicker, please be careful of COVID. I said, don't be a COVID-idiot. He was asking me, what is COVID-idiot? I said, go and check on the same website.